I'm going to explain few things related to immunotherapy in blood cancer care. Immunotherapy is different to traditional chemotherapy in many ways. Immunotherapy will help our own immune system to recognize cancer cells and destroy them. Traditional chemotherapy target rapidly dividing cells. At the same time, it can damage normal cells, which are not cancer cells. New treatment modalities are supposed to be more specific and thought to be with less side effects. Immunotherapy is one of them. There is a very broad area when it comes to immunotherapy. It is not one type of treatment. Some people believe that immunotherapy is not available in Sri Lanka, which is not true. There are different types of immunotherapy. Some types of immunotherapy methods are available in Sri Lanka. If I list few of the immunotherapy method, you might recognize these names. There is a treatment modality called monoclonal antibodies. Those are proteins which will help our own immune system to recognize cancer cells. Monoclonal antibodies are used very widely in blood cancer care, and it is a very important medication for an immunotherapy method in treating blood cancers. Also, now there are biclonal antibodies. So they are the next step from monoclonal antibodies coming into play in blood cancer care. Also, you may have heard about CAR T-cell therapy, which is a type of immunotherapy. I'm not going to list all the immunotherapy methods. What is important to remember is immunotherapy is very helpful in blood cancer care. It is not one type of treatment. Some immunotherapy methods are available in Sri Lanka. It is important to be familiar with these treatment methods and also familiar with side effects and problems associated with these treatment modalities. Immunotherapy is not without side effects. There are different side effects. When I say different, they are different to the side effects experienced by patients who receive traditional chemotherapy. Also, the most interesting part is these non-chemotherapeutic drugs or small agents or immunotherapy or monoclonal antibodies can be combined with each other or with traditional chemotherapy. For example, there is a lymphoma. Lymphoma is a type of blood cancer. There's a subtype called diffuse large B-cell lymphoma. That is a very aggressive form of blood cancer. For that, we use a drug combination called R-CHOP. R stands for rituximab, which is a monoclonal antibody. And the CHOP is a combination of chemotherapy. So we are combining immunotherapy with chemotherapy. And also, immunotherapy methods or novel agents can be combined to treat cancer with each other. If I give an example, there is a type of blood cancer called myeloma. Myeloma is a type of blood cancer. It can be very aggressive. It is not a curable type of blood cancer, but very treatable. That is treated by a combination of medication called DARA-BTD. DARA stands for daratumumab, which is a monoclonal antibody. V is for Velcade or Rituximab, which is a immunotherapy drug. Then the T for thalidomide, it is an IMiD or immunomodulatory drug. And D is for dexamethasone, which is a steroid. So in this regime, there is no chemotherapy. All are novel agents or immunotherapy or biologics, which are combined with each other to treat myeloma when they are newly diagnosed. Again, I would like to stress, some people believe immunotherapy is not available in Sri Lanka, and we have always worked for immunotherapy, which is not true. What I mentioned, all these treatment modalities or drugs, or most of these drugs are available in Sri Lanka.